Chow, talk to me.
Emmy Miles, 15-year-old girl found unconscious, suspected opiate overdose. She appeared to have smoked a fentanyl patch.
Okay, we're going to treatment.
6. I got it, Maggie.
All right.
You give her Narcan?
5 times. She responded in the ambo, just slid back into overdose.
All right, let's move her. On my count. Ready? 1, 2, 3. April, let's give her another 2 milligrams Narcan and hang a drip.
Got it.
Bring her down slowly. Don't want to precipitate withdrawal. Shout. Fentanyl patch. This girl try to kill herself?
No idea, Doc.
Morning, Dr. Choi.
Morning.
This your fentanyl OD?
Yes. Sarah, are you back?
I've invited Dr. Reese to become a psych resident.
That's great.
You think so?
Absolutely. I'm a great believer in psychiatry.
Huh, interesting.
Dr. Charles, this is the patient's mother, Mrs. Miles.
Nice to meet you, Mrs. Miles. This is my colleague, Dr. Reese.
I don't understand this. Emmy doesn't use drugs.
A fentanyl patch is a very high dose of a very strong opioid. This is a difficult question, but I have to ask it. Do you think there's any chance that your daughter could have been trying to take her own life?
No, absolutely not. She's very popular. She has hundreds of friends. She has no reason to kill herself.
Do you have any idea how she might have gotten hold of the patch?
My mother has cancer. She's prescribed fentanyl patches for pain. I suppose she could.
Would you mind if we talk with her for a bit?
Please, go ahead.
Thank you.
Honey, I'll be back in a couple minutes.
Hi, Emmy. How you feeling? I'm Dr. Charles.
And I'm Dr. Reese.
Can you tell us what happened today?
Leave me alone.
We're concerned about you, Emmy, and we need to understand what happened so that we can take care of you.
We just want to help.
You know what? Why don't we come back later? And maybe you'll feel like talking then. You know who the most unhappy people in the world are? 15-year-old girls.
I remember.
Mom said Emmy had hundreds of friends. Hyperbole?
Maybe not. She could have hundreds of friends.
Oh, like that.
Girls her age share everything, they judge everything. Maybe Emmy was shamed and that led to a suicide attempt.
Let me know what you find.
Emmy does have hundreds of friends, 623 to be exact. She's on a lot of social media platforms.
623 friends? Yikes. Who do you invite to the birthday party?
And she isn't always very nice to the other girls.
Not very nice.
She wasn't shamed. She's the shamer.
Interesting. Well, so what do you think?
Maybe Emmy realized she really hurt someone. She felt guilty.
Guilty enough to kill herself?
I don't know.
You know what? We gotta get Emmy to open up. Next time Mom takes a break, jump in there and give it another shot.
Dr. Charles, wait, where are you going?
Well, I just thought Emmy might be more comfortable talking to a woman and somebody her own age.
But I don't know what to say, what to ask.
I think that once you get in there, you'll discover that you do.
Hey. How are you feeling? Your blood pressure looks good. And your heart rate.
You a shrink?
No. I'm barely a doctor. I just graduated medical school. I was checking out your Instagram photos. And you look really beautiful. I always hate the way I look in photos.
You need to take a lot.
You do?
I took about 100 to get that one.
Oh.
I have to look perfect or I won't send it. You've been reading my tweets too? You must think I'm a horrible person.
Why would I think that?
because of what I say about other girls.
No. No, I just think you're under a lot of pressure to be perfect.
Oh, God.
Emmy,
I'm not perfect.
Emmy, nobody is.
You don't understand. Look. It's vitiligo. I Googled it. You can't cure it. It's gonna spread all over my body. Everybody's gonna make fun of me. My life is ruined.
Emmy, did you try to kill yourself?
I don't know.
You don't know?
Just wanted it all to go away.
I'm gonna take a skin scraping. Is that okay?
Why didn't you tell me that you were coming back to med?
I didn't know until this morning.
So you'll be back in the ED?
Not exactly. Dr. Charles wants me to be a psych resident.
You?
Is that such a shock?
I just didn't realize that you had an interest in that.
I didn't. I don't. I don't know. What do you see?
I wish people wouldn't diagnose themselves. They always screw it up. Your patient doesn't have vitiligo. She has tinea versicolor.
A yeast infection?
Yeah.
That's wonderful.
You know, I'm gonna miss the smell of coffee on you.
Dr. Reese, how's our patient?
I gave her ketoconazole cream. Her fungal infection should be gone in a week.
Excellent.
Dr. Charles, I've decided I will take that residency in psychiatry. I see now that by combining my clinical knowledge with psychology, maybe I really can help people.
I am so glad to hear that. You're not talking about Emmy, though, are you? Listen, you very skillfully treated a superficial skin infection. Unfortunately, neither of us have done anything to address the profound underlying psychological issues that she suffers from. Just saying, you know, our patient has a long way to go.
Oh. Yes.
Anybody ever tell you the etymology of the word psychiatry? The medical treatment of the soul. Isn't that marvelous? So, worry not, Dr. Reese. We all of us have a long way to go in healing our souls.